everyone. Welcome to this week's Caregiver Question of the Week. I have here with me today Dr. Brittany Lamb. She's going to help me out with this really important question. And this one is about urinary tract infections. If you've ever cared for someone who has gotten a urinary tract infection, you probably now know how big of a deal that can be. Something that seems really small. And, you know, like if you got a urinary tract infection, maybe you would know it right away. It wouldn't be that big a deal. When the folks that we're caring for, especially as they get older, get urinary tract infections, things can go sideways really fast. So this is an important question. And so Dr. Lamb is here to help me kind of give a nice full answer for you. So I'm going to invite you to go ahead and jump in here. Why don't you go first, Dr. Lamb?
All right. So this is a big topic. Obviously, whatever we can do to prevent urinary tract infections, we should do, because like you said, they can really creep up. They can cause people to have whole body infections. We call that sepsis, need to be hospitalized, can cause change in mental status, big deal. So I will say that, you know, I'm a doctor, and it's hard sometimes when you come on the internet to speak very broadly and give generalized information. So what I recommend everyone do is, as your person is aging, if they've had a urinary tract infection, or especially if your person's a female, because females are more at risk because of their anatomy. So their urethra, the tract from the bladder out of the body, is shorter. And so they're more likely to get bacteria that enters into the bladder and causes infection. I recommend that you talk to your person's medical team, like the next time you interact with them, the primary care doctor, a nurse practitioner, PA, whoever you're seeing, and ask them, what are the things that put my person at risk individually for urinary tract infection that we can try to think about and maybe prevent? So I know that you have a lot of good tips that you're going to talk about, but I highly recommend doing that. So what is my person at risk for individually? You also want to look at medications. There are medications that can decrease urine output. And so those medications can make it more likely that you would get a urinary tract infection. Hygiene is super important, which I know you're going to touch on. If hydration is something that's generally important, and that again, like how much fluid someone can drink, what their recommended amount of fluid to drink in a day, it's very different for different people. So we can't just like make a blanket statement about how much fluid we can drink. So those are big things. I mean, a lot of people you'll see on the internet talk about cranberry juice and supplement and pills and things like this. What I would say is, if you're considering starting something like that, just run it by your person's doctor. You know, probiotic is not a crazy thing. Drinking cranberry juice is not a crazy thing. But, you know, there's medication interactions with cranberries and different supplements and things. So it needs to be my big push and drive here is like, know that this is a problem. Know that your person is at risk for this. We all are. And we all are as we age, and just figure out what you can do for your person as an individual. But those are some of the talking points. And maybe when you start talking, I'll come up with some other ideas.
Yeah, of course. Well, and I think that it really is almost always the most important takeaway so many times from any kind of education that we're providing, or certainly Caregiver Question of the Week, is that, yes, are there general guidelines? Of course, we can think about these general things, but at the end of the day, it's not a substitute for a individual interaction with the healthcare provider for that person. So thank you for reminding of that. Keep in mind, everyone, this is for educational purposes only. This is not a substitute for health or medical advice or a therapeutic relationship in any way. So do make sure, if anything that we say reminds you of someone that you're caring for, or yourself, someone that you know, make sure you're advocating for that person to get assessed and treated correctly by the right healthcare provider, because there really isn't a substitute for that, unfortunately. I do have some tips to share along these lines, though. So a lot of times there are things that we do think about with urinary tract infections, and then there are things that don't necessarily obviously come to mind. One of the things that we think about more commonly is having good hygiene for the groin, right? Making sure, you know, particularly for women, that we are wiping from the front to the back and not the back to front, so that we're not spreading bacteria. Just making sure that we are overall providing good hygiene in the first place so that bacteria is not building up in the groin, where it can travel up that urethra and cause a urinary tract infection. But there are some other things too that we don't always think about that can be really helpful. One thing is, the more upright we can have someone when they're using the restroom, the better their bladder is going to drain. Your bladder and the draining of it works much more effectively with gravity. It's actually designed to work with gravity assisting it. So the more upright someone can be when they are urinating, the more that bladder is going to drain, and that can help to reduce the risk of things like urinary tract infections. Now, of course, sometimes people cannot be upright when they are using the restroom, right? Sometimes people they're not strong enough, they have balance issues, they're bedbound for whatever reason, and they just can't be upright. So in those cases, is there a perfect solution to get them more upright while they're going to the bathroom? Again, this is actually really something that you need to talk with individually about, usually with an occupational therapist or another healthcare provider, to see what positioning strategies might work for that individual person. But also, again, knowing that the person you're caring for may be at an increased risk because they're bedbound, because they can't be upright to go to the bathroom. Just your awareness and your ability to advocate for that person as a result of that awareness, it really, really goes a long way. One of the other helpful tips I like to talk about too for preventing urinary tract infections, and frankly for just coping with incontinence as well, has to do with timed emptying of the bladder. You can also do timed or scheduled emptying of the bowels too. Your body can kind of literally learn a schedule for that. Yeah. And of course, if you know when a bowel movement is going to happen, that helps to keep all of the groin area clean and prevent infections and bacteria from building up. And if we can get people kind of emptying their bladders and emptying their bowels on a regular schedule that's predictable, that means we're going to have less buildup and a lower likelihood of infections too. So those are some kind of like functional ways that you can think about helping to prevent urinary tract infections.
Yes. I wanted to piggyback on what you said. So constipation can cause someone to have difficulty emptying their bladder. And so constipation is a very common cause or co-contributor to urinary tract infection. And so I also advocate that people have a good bowel regimen. And so that needs to be individualized as well. But there are lots of medications that, like stool softeners, Miralax, there's lots of different products out there to try to make sure that someone's, moving their bowels regularly. Obviously, their diet is going to play into that, how functional they are, how much movement they have. Medications. So there's lots of medications that cause constipation. So anytime there's a change in someone, you should always consider that the medications are what's doing it. Like that's the first thing that I want people to think about a lot of times when there's something new happening. But constipation is a big deal. And the other thing that I was thinking when you were talking to is men and enlarged prostates. So that's another really, really common thing that happens. It causes, the prostate is a gland that's around your urethra, right after your bladder. And so if that is enlarged, it can compress the urethra, so it doesn't drain the bladder as well. And so working on an individualized plan for your person about how we can best deal with that, whether or not seeing a urologist, a specialist, and if there's anything that can be done on a medication or even a procedure for the prostate. So there's lots of things out there that can be helpful. But I think thinking of the person as a whole and figuring out what your person's individualized risk would be where I would start. Just knowing that, when you're a caregiver, just know that your person's going to be at risk of a urinary tract infection, and work to create a plan into how you can decrease that risk for them.
And again, I think the big takeaway here, working with the healthcare provider for the person that you care for, thinking about it in kind of a holistic sense. So not just having a conversation about one aspect of it, but also saying, well, this is how the person I care for toilets. This is how this happens. These are all important big parts of the picture. And when you are having the conversation, it'll probably be the doctor who you're initially having the conversation with. When you bring up those things, it can help you to advocate for having maybe an occupational or a physical therapist come in, or it can help that doctor to ask more questions so that they know the whole picture, and then they can really work to make sure that you have all of the members of the team available to get the right instruction and the right intervention for the person that you're caring for, so that we don't have as many of these things happen to begin with, because it's no fun.
Yes, I think that's so valuable, Amelia, like when you talk to a healthcare provider, like knowing that sometimes there's gaps in our knowledge, and so you might need to advocate that, is there someone else that could help me, improve my person's functional ability so that this isn't a problem? Like just thinking outside the boxes, and the fact that now we're able to collaborate, me and ER doctor, you and occupational therapist, it's like, can be super helpful to folks. So definitely, if you want more help, don't be afraid to ask, don't be afraid to advocate and say, hey, look, I know positioning is a big deal. I know hygiene is a big deal, but you're a doctor. Do you know how to clean? I don't know how to clean people. Nurses and techs do that. I don't know how to bathe anyone, I don't. I mean, it's a deficiency in my training, right? It's not what I do. So you have to realize that we don't do those things. And so we may not even consider that part of your person's workup. I do want to say also that if your person has a urinary tract infection, I highly recommend that you ask to have a culture sent, a culture to see what type of bacteria is growing, because it can help us pick the right antibiotic and know if there's an issue with any drug resistance. I always like to talk about that because it bothers me when I see, sometimes I know it can be logistically challenging to get the person to the doctor or to collecting urine. I understand, and so sometimes we do just give antibiotics because it seems like this person has another urinary tract infection. But whenever you can, getting a culture is really helpful for us.
All right. Well, thank you so much for joining for this episode of the Caregiver Question of the Week. I think that this was, obviously, we had a lot of information. You could probably rewatch this about 12 times. I think to kind of get it all. But, again, that big takeaway is making sure that you're talking with your healthcare provider to get the individualized plan for the person that you're caring for. Dr. Lamb, thank you so much for joining for this Caregiver Question of the Week. And hopefully we'll be able to collaborate on this kind of stuff more often.
Yeah, I'm happy to. People, send us your questions and we'll get you some answers.
Yes, absolutely. Okay, guys, until next time, please be healthy, be well, and most of all, take care. Bye.